I'm Dr. Seemal Desai. I'm a board-certified dermatologist in private and academic practice in Dallas, Texas. I'm also one of the co-directors for the Winter Clinical Meeting, and it's fantastic to be able to give you a quick recap of my talk on managing autoimmune diseases of the hair and skin, and which I was able to present as part of this year's 2021 Winter Clinical Virtual Meeting. One of the interesting things right now for managing autoimmune skin disease and hair disease, particularly vitiligo and alopecia areata, which is what I focused on in my talk, relates to the fact that we have new novel small molecules, both in topical and oral formulation, which are being developed that really could help us at a molecular level target these devastating skin conditions. So with alopecia areata, I talked about things such as topical ruxolitinib 1.5% cream, topical tofacitinib 2% cream, and the oral versions of both. And I also talked about those for vitiligo and some of the new Janus kinase inhibitor drugs that are being studied. The message is these are still FDA off-label. They are a source of hope and inspiration for our patients because there is efficacy there when we look at it in the studies that have been done, but more studies are needed. I have found that in my alopecia areata practices, the topicals, specifically the ruxolitinib 1.5% cream and the tofacitinib 2% cream, are not as consistent in their results in getting hair growth back for my patients. When it works, it works. When it doesn't, it doesn't. So the results with topical JAKs in alopecia areata, in my experience, and from most of what I've read in the literature and being able to present, is not consistent. Conversely, in vitiligo, we do see really good results. In my opinion, comparing tofacitinib 2% cream to ruxolitinib 1.5% cream, I find the Rux works better for vitiligo, and there is some molecular explanation for that mechanism, especially when combined with UV light. A lot more on the horizon. This is an exciting time for diseases like vitiligo and alopecia areata, and I hope you'll join us for the rest of this meeting and for future meetings to come. Thank you, and enjoy the rest of Winter Clinical 2021.